Welcome back. There is a live look outside that is such a gorgeous view from the Oregon coast. That's our In It Spanish Head Resort Hotel camera in Lincoln City. Thanks for watching Afternoon Live. Sports bring so many good things to kids, but sports can also bring injuries. Here with tips on how you better protect your child from concussions to sprains, we welcome pediatrician and the author of Doing It All, Dr. Whitney Casares. It is great to see you, and this is a really good time to talk about this stuff.
Totally.
A lot of our kids
sports gear. I'm ready.
Sporty mommy. A lot of our kids are in fall sports right now. Let's talk about just simple prevention things across the board, no matter what sport, that you can protect your kids from injuries before they happen.
Yeah, for sure. Okay, so the biggest thing is actually to diversify the types of sports that your kids are in.
Okay.
So I know sometimes we think our kid's going to be gold medalists or like an NBA player, but most are not going to be.
Yes.
So resist the urge to put your child in only one sport, because that's going to work different muscles, strengthen different muscles. That is going to reduce injury. So that is always my number one. Number two is going to be make sure that your child has enough rest, enough food in their system, enough hydration, so that way they're not going to make silly mistakes and their body's going to work appropriately.
Yeah.
And then finally, make sure that your child warms up. Coaches should be making sure that kids are doing stretches, doing some light cardio before they get into a game or a practice.
It is tough because I'm coaching 7-year-old soccer right now, and they are just balls of energy.
Yes.
They just want to go, go, go. So
They're
we have to be in charge and say, you have to have your water bottle, and we're going to gradually get into this so that nobody gets hurt.
That's right.
And then if you do have an injury, you need to rest.
Mm-hmm. Yes, so that's the hugest thing. As a pediatrician, so often my advice when a kid comes in with an injury is you need to take a couple days off of the sport.
Yeah.
You got to rest, because that's going to make it so your body can then get back into it a lot faster. And I know it's difficult. I have kids in sports too, but parents and kids, please just take a break when your body needs it. The other thing is there's a simple mnemonic that we use in pediatrics and medicine in general called RICE: rest, ice, compression, elevation. Your pediatrician can walk you through this, but it's basically resting your body, using ice in 20-minute intervals, using compression like an ACE bandage if there's something that's specifically hurting, and then elevating that area that's injured above the level of your heart as much as possible.
Easy stuff, and a short investment of time in that rest phase will pay off in the long run, and you don't get an overuse injury.
Exactly.
Let's talk about concussions. What are some things to look for? We do have to take this so seriously.
Yeah, for sure. So concussions a lot of times can happen from a high impact injury that happens in soccer, in football, but also in less of those traditionally dangerous sports.
Yeah.
So it can just be if two kids are colliding on the playground, you can get a concussion. The symptoms are disorientation, vomiting, you might have really severe headache, you might be really, really tired, you could have memory loss, you might have had some loss of consciousness when you get the concussion. Your doctor, again, your child's pediatrician, is well skilled to be able to evaluate to say, does your child have a concussion or not? If they do have a concussion, again, the biggest piece of advice we're going to give, this is an investment, is to rest your brain.
Yeah.
And this is the reason. Just like when you hurt your wrist and it swells up, your brain, when it gets injured, when your head gets injured, it can swell as well, but it doesn't have anywhere to go because it's not just surrounded by skin, it's surrounded by the skull. So we need to make sure that we give it time to de-swell and to not swell even more. And usually that's going to be about 48 to 72 hours of really doing absolutely nothing with your mind and with your body in order to let your brain get back to baseline.
What about the dangers of repeated concussions? Maybe your kid is in a high contact sport and this has happened a couple of times. Do you change the protocol in treating it and then kind of maybe having some bigger conversations as a family about safety?
Yes, absolutely. So the more concussions you have, we know that it's a compounding issue. It can cause even more risk for brain injury over time and for cognitive dysfunction. So we want to be really careful. If a child ends up having multiple concussions from the same sport, maybe it's time to switch to something else. We see this even in professional sports, that they're trying to really take it a lot more seriously because we're starting to see the impacts of how emotionally and physically it can make a difference in a person's life.
And then what about sleeping after you maybe suspect a concussion, you're having some challenging symptoms? Are you still supposed to wake kiddos up every few hours. Is that part of the protocol still?
Right, so that is a bit outdated.
Okay.
We actually want kids to rest when
Okay.
they have a concussion. That's an important thing. There are a few issues that if they're happening can signal that there's something like a brain bleed or a lot of pressure happening inside the brain that are serious and need to be addressed right now. You cannot let your kids sleep. So this would be if you can't wake your child up
Right.
once they are sleeping, if your child is vomiting excessively or repeatedly, if they're having the worst headache of their life, or if they're having really severe vision changes or a lack of vision. These are all things that are emergencies. You want to go to the emergency room for that.
And then what about other injuries, concussion or otherwise? Is there a certain line that you would look for in terms of this can be just a rest situation at home, or we might need to go to an urgent care or an emergency room? How do you kind of know when you need to seek that professional help?
Yeah, so a lot of it is about the severity,
Okay.
but it can be hard to understand the nuance. So I always say err on the side of caution, go to the pediatrician. A lot of times the schools also, if they suspect a concussion, even if it's not that, they want you to be cleared by the pediatrician before you return to sport. We also have different testing we can do that's a little bit more objective. So we can test the cranial nerves, we can test strength, and we also have testing we can do to test cognitive function for kids, because it's not just about what are your symptoms physically, it's also how is your brain working. So we use a combination of those things to decide, is this a concussion? And if so, what's the proper treatment? And when should we be returning back to sport?
Okay, and then what about any old bumps and bruises, different medications like Tylenol versus an ibuprofen? How are you deciding what's the best thing?
Yeah, absolutely. If there is any risk or concern at all for concussion, we recommend Tylenol as the medication of choice, or acetaminophen as the medication of choice, because we don't want there to be, on the off chance that there is a bleed, a drug like ibuprofen that is in the system that could potentially exacerbate bleeding. So we want it to be Tylenol, so go for that first. And again, if in doubt, call us, see if you need a visit. We're happy to see you because we care a lot about kids' health. We want kids to get back to the sport as soon as possible, but not have lingering symptoms that make it so they're gonna have even more chance of concussion later on.
Sometimes it sounds scary to talk about these things, but when you think about how much we've learned and how much more knowledge we have so many more tools to tackle these things and keeps kids as safe as possible.
Absolutely.
Okay, thank you so much. Great to see you.
Great to see you too.
Dr. Whitney's book again is Doing It All, and we'll have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.